Welcome to your Therapy Sesh. I'm Dr. Tiffany Bartell. This week, we're going to talk about mental health and well-being. What is mental health? Many times when you hear someone talking about mental health, they're talking about mental illness or a disorder in their mental health. But the World Health Organization defines mental health as a state of mental well-being that enables people to cope with the stresses of life, realize their abilities, learn and work well, and contribute to their community. In the same way that we would describe ourselves as having good physical health, if we have energy, can exercise, and engage actively in what we want to do, we can consider ourselves to have good mental health if we're able to engage socially, emotionally, psychologically, and cognitively in our lives. So, this leads us into what is well being. Well being can be defined as a concept that encompasses our mental, physical, emotional, and social health. And when we have a sense of well being, we experience a sense of happiness, purpose, and life satisfaction. When I was in graduate school, they taught us something called the biopsychosocial model, which is a way to understand our mental health holistically. The idea is that health is made up of wellness in multiple facets of our lives, and health in one area is affected by health or illness in another part. This model incorporates biological factors, psychological components, and social health. Looking at our mental health holistically can help when we're trying to figure out maybe why we don't feel well at times when we're exercising regularly, getting lots of sleep. But it could be that we are experiencing isolation or loneliness in our social health. And maybe we are socially connected and we have physical health, but we struggle with anxiety. And that is affecting how we feel that other people see us or look at us and how effective we can be in the world. So I find that people often think about happiness and well being as a byproduct of a good life. Kind of like you put gas in a car and exhaust comes out the tailpipe. We often think that if we put hard work and integrity into our life, that happiness will come out our tailpipe as a result. Happiness is a product that we have to build and is tied in closely with this idea of well being, which is fed by good, strong mental health. In these short monthly chats, we're going to talk about topics related to mental health and well being and how you can protect and strengthen both. That's all we have for you this time. Thank you so much for listening. Tune in next week and we'll have a conversation with Natasha Montgomery, host of the podcast This Therapist Has Problems and an expert in Black mental health. And next month on Therapy Sesh, we will talk about people mirrors. What are they and how can we use them? Remember to be gentle with yourself, and we'll see you next time. If you're listening to How Would You Rate Your Pain, you're probably a person who understands the power of talking through the issues that we're going through. I'm really excited to let you know about BetterHelp, an online therapy platform. I'm not one of their therapists, but very thankful they sponsor this show. Wherever you are, BetterHelp will match you with a licensed therapist who can listen and help you through whatever you're going through. It's flexible and entirely online. Listeners of the show can get started with 10% off the first month by clicking the link in the show notes or by going to betterhelp.com/Tiffany Bartell. How Would You Rate Your Pain is a pop media production and is recorded at Wavelength Studios in downtown Chattanooga, Tennessee. Our set is designed by Mad Honey Rentals, graphic design provided by Josh Wilhelm at JW Creates. Music is by Michael Crosa. This podcast is not intended to be taken as medical advice and should not take the place of regular therapy. If you have questions about your mental health, see a licensed clinical therapist. I'm Dr. Tiffany Bartell. Please follow us on Instagram and Facebook at How Would You Rate Your Pain. Thank you for listening, and I'll see you next week for another episode.